Hello, my name is Ludmilla. I will talk about circulating tumor cells in desmoid tumors. Primary tumor releases circulating tumor cells in the blood that can reach distant sites and form metastases many years after this first release. The primary tumor can also release another components, such as circulating tumor DNA, extracellular vesicles, proteins, tumor-educated platelets, and metabolites. So all these components that can be found in the circulation are called liquid biopsy, and are some advantages of liquid biopsy in relation to tissue biopsy. Liquid biopsy is minimal invasive. There is no pain when the patient make the liquid biopsy, no risk of complication. It's quick to make it. It represents the tumor heterogeneity, and there is no tumor buyer selection when we evaluate liquid biopsy, and it is compatible with the longitudinal monitoring. Circulating tumor cells can be evaluated by many methods. There are more than 30 methods described in the literature, and we can isolate the cells based on biological properties, by their physical properties, or by functional assays. We can use some surface marker expression to do the positive selection of the cells with EpiCam for solid tumors and negative selection with CD45. Methods based on physical properties are used in the literature too. The most used is ISAT. It's based on size. It's a filtration method, and we use this method at ACCamargo Cancer Ce. And there are also functional assays that can evaluate, for example, the secretion of cytokines by circulating tumor cells. As we know that circulating tumor cells can express epithelial markers as also mesenchymal markers, it's difficult to use a method based only on biological properties. If so, we can add many different antibodies to properly select the cells. Circulating tumor cells can leave the primary tumor and circulate as clusters also, clusters that can be homotypic, formed by one clone of cells, or heterotypic, formed by many different clones. We can also find circulating tumor cells with features of stem cells, and the most common is to find in the blood of patients with solid tumors cells with many different properties. At ACCamargo, as I told before, we use ISAT, that is a filtration by size. After the blood filtration, we can remove this membrane from this block, and in the membrane, we have many pores of 8 micrometers. The majority of the cells of the blood pass through the pore, and the circulating tumor cells stay in the membrane. Here is a typical circulating tumor cells with an abundant nuclei and a scarce cytoplasm, and hyperchromatic nuclei. After the isolation of the CTC, we can do cytopathological characterization by cytological staining. We can do molecular characterization by immunolabing and FISH and SISH, molecular characterization by RNA, DNA analysis, and also counting circulating tumor cells, of course. And for solid tumors, there are many clinical trials registered, and in the world, there are 963 studies. In the United States, 420 studies. I made this search in March of this year. And in Brazil, we have 11 studies. We all know that circulating tumor cells are established for prognosis for solid tumors, but there is a gap in literature in relation to therapeutic decision. There are some ongoing trials trying to solve this question. if we can use circulating tumor cells as a biomarker to take clinical conduction. We work at ACCamargo Cancer Center with circulating tumor cells using ISAT since 2011. And we have some papers published with solid tumors. Then we asked if we can use ISAT to isolate circulating tumor cells from the blood of patients with sarcoma. And we were the first literature to show that, yes, we can use ISAT to evaluate the cells. And we, for our surprise, we found many cells in the blood of patients with different types of sarcoma with different stages. Then the next question was, can we use this method to try to find circulating tumor cells in the blood of patients with desmoid tumors? We know that desmoid tumors are a clone of fibroblast proliferation that appears in deep soft tissues and is characterized by an infiltrative growth and a tendency to local recurrence, although unable to metastasize. So these tumors release circulating tumor cells in the blood? We didn't know. And we know that by immunohistochemistry, we can, the pathologists evaluate the expression of vimentin, actin, and beta-catenin in the tissue. And beta-catenin has been used for diagnostic confirmation. Then we included 18 patients with desmoid tumors, and we found circulating tumor cells in their blood with ISAT with different shapes and with different degrees of beta-catenin staining and with different degrees of vimentin staining. We also found clusters of circulating tumor cells expressing and not expressing vimentin. And we compared the expression of beta-catenin of circulating tumor cells with the primary tumor, and we found 35% of concordance, of agreement. Here we can see that the values, the counting of circulating tumor cells in the blood of these 18 patients varied a lot. But yes, we answered the first question. We can find circulating tumor cells in the blood of patients with desmoid tumors. But what is the whole of the cells in this tumor? We don't know yet. This is the next step. Maybe the cells are collaborating with the growth of the primary tumor, with the theory of the self-seeding. Maybe these cells are interacting with the cells of the immune system, as we know that for solid tumors, they interact. And maybe we can use circulating tumor cells in desmoid tumors as we use for solid tumors to follow up patients during the course of the disease. Now we are trying to solve these questions. We hope we have the answers soon. Thank you for your attention. Here is my contact. Thank you very much.